On Senate Bill 859. Oliver.
Madam Chair, members of the committee, Senate Bill 859, the measure would require licensed physicians that practice oncology in Oregon to discuss fertility risks with adolescent oncology patients. Requires the Oregon Medical Board to adopt rules and implement provisions of the bill. There is a -1 posted on OLIS, no impact statements.
Well, thank you. My name is Rico Dents. Do I repeat?
Yes.
Okay, my name is Rico Dents, and I started the Great Ribbon Rally, and I've been to 20 states in the last, since June, and I've met with a lot of young adults dealing with cancer, and a lot of them have talked to me. Probably 95% of them said that the doctor didn't talk to him, the oncologist talked to him about fertility prior to cancer treatment. And this is an important issue. According to Stupid Cancer, only 13% of oncologists do talk about fertility options. I've also seen the National Coalition of Cancer and NCCN, and they have basically the top 20 hospitals in the U.S., and they do talk about the importance of fertility and discussion on it. But on other statistics, less than 50% of educational facilities ever talk about fertility options. And non-educational hospitals, it's less than 10%. So, I mean, there's a lot of questions across the board on what it is. But the problem is that once you're diagnosed with cancer and you get some chemotherapy, it could cause you to become infertile. Women never grow new eggs. They get the eggs in the ovaries right away. And then adult males, that's a whole different thing. But preserving fertility is a very important issue. And why that's important is we've gotten now people who are surviving longer don't necessarily think about once you're diagnosed with cancer, you're not thinking about fertility. You're thinking about, am I going to live? What do I need to do to live? And you're now learning either chemotherapy or other regimens that are going on. And I was over at Yale Hospital in February, and I was at the Young Adult Smilo. It's called Impact Group. There were 6 of us. There's 6 other people, and I was the only guy there. And we were just talking about this issue. And in Yale, which is one of the top hospitals in the world, all of them didn't feel like they were adequately discussed fertility options prior to their treatment. And they learned stuff afterwards. I was down in Houston with a friend of mine. I met him and talking, he had stomach cancer. And just that day prior to his oncology treatment, he asked the nurse, is this going to cause me to become infertile? And he was like, the nurse was like, yeah, no one talked to you about it. So this is an issue because being able to have a kid in your arm is the most important thing. I mean, after being diagnosed with cancer, and dealing with that and dealing with those emotions, then being told now you can't have kids because you were not discussed fertility options and you not preserved your fertility. And I've heard stories and upon stories of people who have talked to about that. And it's just sad because I was living with cancer and I couldn't imagine, because I could have kids in the future, but I couldn't imagine after just dealing what you've had to deal with the financial challenges, deal with the emotional challenges of friends and other issues. And then finding out, you finally find a spouse or a husband, and you got to tell them that I can't have kids. That's tough situation. So let's help prevent the double whammy.
So you're saying that, I mean, it is possible then to freeze your sperm or freeze
Yes.
the eggs ahead of time, and you're saying that this is not a routine practice among physicians.
Yes, and even in the non-educational facilities, even with testicular cancer patients, 10% of the doctors talk about preserving fertility.
Well, the representative from the Cancer Society is in the back room,
Yes.
and I'm sure he's taking notes to share that, to see what kind of education that we can disseminate. Stay there, but we need Trevor Belts to come up from the Oregon Medical Association.
Good afternoon, Chair Monis Anderson, Vice Chair Cruz, members of the committee. My name, for the record, is Trevor Belts. I'm the Associate Director of Government Relations for the Oregon Medical Association. I want to thank you for the opportunity to testify on Senate Bill 859 today, which would require oncologists to discuss fertility and adolescent patients to discuss fertility with adolescent patients before they undergo necessary chemotherapy, radiation, and other treatment that could pose risk to a patient's fertility. The OMA and its members understand firsthand how difficult it is for a patient and family to go through diagnosis and treatment for any type of cancer. Circumstances of an adolescent with cancer are very emotional for all involved and rightfully made more difficult given the fact that treatment may negatively impact a patient's fertility. With that, however, the OMA has some serious concerns with the bill before you today, concerns shared by our partners at OHSU, and I'd like to outline several points that I've discussed with OMA's oncologist members on the issue. It is our understanding that the standards of practice already exist to discuss fertility issues with new adolescent cancer patients. I cannot speak to other states. I cannot speak to the number of, the prevalence of that, but the oncologists that we were able to speak with thought that this was a standard of practice, at least in Oregon. It is important to understand that there are many components to this discussion. For example, especially in adolescent cases, time is the enemy, and many diagnoses require urgency in the treatment plan. The other component of this very sensitive and difficult issue that is not addressed in this bill and provides even more of an issue for these young patients is the cost to preserve fertility options like sperm or egg preservation. These procedures are often out of the question financially for the patients and their families and are rarely covered by insurance plans. So in conclusion, we think this legislation, although brought forward with very good intentions, is an unneeded bill, and we do not believe that having prescriptive language in how physicians treat their patients should be placed in statute. Thank you.
I would hope, though, that if someone is diagnosed, I mean, sure, it's one thing when they're diagnosed when they're 2 or 3 years old, but if they are adolescents, I would hope that every physician would discuss this with the patient, and I don't know if that's standard practice or not.
It's not.
So I would hope that you would share this hearing with your members and, well, with the oncologists in particular, to see if there could be some kind of standard of care for adolescents. I haven't worked much with cancer patients, so I can't relate to the situation, but I know if I was diagnosed, I certainly would. You know, when you're diagnosed, you're going to beat this. You're going to fight it, and you want to go on and live a normal life. And I would hope that that opportunity would be given to that patient, if, in particular, that they would want to have a family in the future. Yeah, Senator Cruz.
I'm wondering why it would be limited to teenagers and not include young adults.
Section 2 actually addresses that part. Section 2, which is oncology and young adults. So it is actually cancer patients on Section 2. We were talking about that yesterday.
Yeah. That would be a parental decision also when they're that young.
I apologize for coming in late. I was actually out being a doctor. So obviously I think it's super important to make sure that people understand about long-term options for fertility at every age, regardless. I mean, we deal with this obviously with people with other chronic illnesses. We need to talk with them about fertility issues and safe plans for the future. But I guess the concern I have is that I worry when the state gets in the business of mandating what goes on between doctors and patients. And in general, we try really hard to stay out of the exam room. And as a physician, I'm glad of that. Can you think of some alternative ways we could approach this that would accomplish the goal of substantially increasing, not mandating, but substantially increasing the likelihood that this problem would be addressed without putting it in statute?
Yeah, no, good question. The problem is that I've thought about it, and I thought either prior to treatment, even having the social worker talk to him about it, or having another person, because I've talked to social workers across the U.S. And they say that the doctors are not adequately giving the fertility discussion. There's a lot of stuff that happens also at the moment when I don't know if you've ever diagnosed someone with the cancer.
I have.
So
I don't like it.
It's not an easy discussion. So, and that's why it's important to have, like, with the sign off and saying, hey, this is something to consider on your fertility. What he didn't mention too, there was two things. He didn't give any statistics on how often the doctors were talked about fertility options. Second, federal mandate actually requires insurance to cover some of the fertility stuff.
Sure.
But there is a two-step process. You have to get denied from the insurance and go to the board, the health board in Oregon, and that's across every single state. And this is some of the stuff that we're working on, getting more knowledge. Alice, I can't think of from the organization who testified in writing about this particular issue as well. And she told me, because she called me and told me these are the different issues and how to address even the cost of fertility and preservation. A lot of people don't know about it, and it's just taking time to learn.
Yeah, absolutely.
And even timing. I understand the timing. There's certain cases, and he's right. Certain leukemias, if you don't get, and certain other cancers, if you're not treated right then and there, you're going to die. So there's not the ability to have preservation. And I know we have to work on allowing the health board to make some rules and regulations on that. And allow the doctor to make the decision, hey, in my opinion, there's no way we could do fertility because it takes 3 weeks, or I think it's 4 weeks for women. Men, it's a lot easier timing to do stuff.
So, Madam Chair, if I may, I am entirely sympathetic to what you're trying to accomplish here, and I absolutely want to make sure that our younger cancer survivors have every opportunity to live a normal life, including becoming biological parents, should they so choose. As I said, I would love to be able to have you guys be thinking creatively about ways to work closely with the oncology community. I mean, for example, I know that Dr. Drucker, who's the head of the Knight Cancer Institute, is very interested in making sure that we deal really well with cancers in younger people and young adults, and I know that he's looking at ways of taking a much more holistic approach to it. So is there an opportunity for you to work with the Knight Cancer Institute? Is there an opportunity with Cancer Center at Providence and some of the other bigger cancer centers statewide? Most younger people are being treated either at Legacy or at Dornbecker because they have the pediatric expertise that a lot of other places don't have. Really sympathetic, and I just don't know what other steps you've tried so far to work with the oncology community directly about this issue, besides talking to social workers.
Senator Hayward, as working with oncology, there's a lot of red tape and time and effort to go through on that side. Second, what we don't always think about, we might be thinking about who's one doctor, but majority of the time, like even the older oncology, like not in educational facilities, because non-educational facilities talking about fertility is very low. It's less than 13%. And so within that, the problem is too, is when a doctor doesn't typically have a young adult about colon cancer or other cancers, they're not thinking about fertility. And that's part of the issue, is because they've not thought about the fertility in the non-educational facilities, and even at educational facilities. And it is making importance of saying, hey, we need to talk about this. And how much effort we're trying to go to every single hospital to go and do this, because that's really, at the end of the day, it has to make every single hospital to talk about it. And within that time frame, there's young adults who are not being able to preserve fertility options.
I would like to read into the record Alice Christie's. She's a 9-year breast cancer survivor, and she was able to fulfill her dream of having a child because she, and this is in her statement, I discussed fertility risk with my oncologist prior to receiving cancer treatment, and then was referred to an oncofertility specialist in time to do something about it. So she also went on to say that really our few patients are afforded this opportunity because cancer centers have really failed to implement an informed consent procedure that ensures the fertility risk conversation. A recent article published in Cancer quoted a study in which only 13% of reproductive age breast cancer patients were informed of that their fertility would be at risk from the life-saving cancer treatment. And so, I think this is the start of a really very important conversation, and I so thank you for bringing it forward. Any other questions?
No, thank you.
Thank you so much for coming. It was a delight to meet you, and I wish you the best of luck.
Thank you so much.
Okay. With that, I will close the public hearing on Senate Bill 859, and I would like to open